Well, I obviously don't agree with the premise of her question. The fact of the matter is that she's seeking herself to politicise the situation. The reality of the matter is this isn't a partisan issue. We all know and respect and cherish the independence of the Crown Prosecution Service, and that's a long tradition in this country.
Liz Cunningham.
Thank you very much, Mr. Speaker. May I first congratulate my honourable friend for her first physical appearance at the dispatch box as our Shadow Attorney-General. Now, there were 394 assaults on police officers in just the Thames Valley and Kent Police Force areas between March and April, more than the total number of prosecutions nationally. Given the numbers of assaults across the country must run into thousands, just how is the CPS, bereft of resources, going to prosecute all these cases, virtual or otherwise?
Well, I thank the honourable gentleman for the question. I'm pleased to say, of course, that the CPS isn't bereft of resources. In fact, £85 million was sent to the CPS before this crisis broke out, which was 100% of their request for funds. The reality of the matter is, though, that assaults against police officers, assaults against all emergency workers, are taken extremely seriously by the courts. They're given priority by the Crown Prosecution Service, and we are dealing with those matters. The system is dealing with those matters robustly, and I think the evidence will show that.
Thank you, Mr. Speaker. The Solicitor General has just set out that he realises there are concerns about virtual hearings. I wonder, though, if he can be a bit clearer about what steps the government are now taking to ensure that vulnerable witnesses and vulnerable defendants, in particular, are properly protected during this period, not just have an acceptance that there's an issue, but what is being done to make sure that justice is done and seen to be done in virtual proceedings.
Well, she's absolutely right to raise that point, and it applies, of course, as she says, to vulnerable defendants as well as to witnesses, all participants in these proceedings. And we know that the courts are, each individual court, each tribunal is responsible for ensuring the best possible course of action in each individual case. It won't be every case that a virtual hearing will be appropriate, and where there are particularly vulnerable issues, vulnerable persons involved, perhaps a virtual hearing won't be appropriate. But we don't micromanage that. We have to ask each individual judge to have that in mind when they make decisions about virtual hearings. But where virtual hearings do take place, we want and expect them to take place in the confines of a situation where everyone feels comfortable and is able to perform the functions required of them.
Rob Butler.
Thank you, Mr. Speaker. The CPS has done sterling work to ensure that offenders can still be brought to justice in the current crisis. But can he give me more details about how the CPS has ensured the best interests of victims, many of whom may never have experienced the courtroom system before, how their best interests are being served?
Well, sometimes alternative mechanisms are in place. So, for example, remote hearings can take place using more than one courtroom. It is sometimes possible for hearings to take place via technology from the home of various individuals, but each individual circumstance will have to be looked at in the course of the assessment of each individual appropriate measure in each case. Caution is being exercised, but 4,000 virtual hearings have already taken place in the Magistrates and Crown Courts, and we expect to see more of them.
Catherine West.
Thank you, Mr. Speaker. Legal aid practitioners play a key role in access to justice. What consideration has the government given to hard-pressed legal aid lawyers who, for example, need more flexibility with their billing and with their business rate relief in order to keep them going so that when the cases do reopen in courts, they can pick that up?
Well, the Honourable Lady asks an important question about support for law firms during the outbreak, and the CPS has made changes to its systems for paying fees to advocates to help support them during this difficult time. I joined a meeting of the Bar Council, a virtual meeting, and the Bar is conscious and content with the work that the government has done. Of course, there's always more that can be done to relieve financial pressure. I see also, and we're grateful for the fact that the Inns of Court have also been supporting junior barristers financially with ongoing funds. The Ministry of Justice is working closely with legal practitioners to understand the impact of COVID-19 and streamlining the process for financial payments.
Anthony Higginbottom.
One of the biggest problems we've got in bringing prosecutions against those who assault our emergency services is a lack of evidence So could the Solicitor General set out what steps are being taken to make sure the CPS has access to that evidence, including making sure our emergency services have better access to body cameras?
Well, I'm grateful for his question, and we will certainly take on board what he says. Body cameras are, of course, an increasingly used piece of evidence. This does actually, in effect, often add a workload burden to the court system because there's so much video evidence, so much more virtual evidence now coming into play. But the Crown Prosecution Service has seen a dramatic increase in its funding from Her Majesty's Government, and we will be making sure that in terms of the payment for members of the legal profession, that is expedited where we can.
Final question, Ellie Reeves.
Thank you, Mr. Speaker. The coronavirus pandemic has exposed inequalities facing the BAME community, and the legal sector has proved no exception. 55% of BAME barristers earn more than half their income from legal aid, and 84% cannot survive a year without support. So what urgent action will the Solicitor General take to reverse LASPO and restore funds to legal aid?
Well, we are supporting the legal aid system as we always have done, and the reality is that we're expediting outstanding fee schemes where payments need to be made more quickly than normal. We've reduced the stage lengths before payments are made in the cases that are ongoing. We have concluded main hearings and ongoing cases and made payment before hearings have been concluded. So there's a multiple series of measures that are being made to assist everyone at the bar, and in fact in all branches of the legal profession, including payments of upfront fixed fees of £500 for COVID-19 matters. So every measure is being taken to support the legal profession, but I accept that there are challenges, as there are in many professions during this crisis.
In order to allow the safe exit of honourable members participating in this item of business and the safe arrival of those participating in the next, I am now suspending the House for 5 minutes. Order. Order. We now come to the urgent questions. Minister for Women and Equalities to review the disparities, risk and outcomes of related COVID-19. Minister.
Thank you, Mr. Speaker. And with your permission, as a black woman and the Equalities Minister, it would be odd if I did not comment on the recent events in the US and protests in London yesterday. Like all right-minded people, regardless of their race, I was profoundly disturbed by the brutal murder of George Floyd at the hands of the police. During these moments of heightened racial tension, we must not pander to anyone who seeks to inflame those tensions. Instead, we must work together to improve the lives of people from BME communities. It is in this spirit that we approach the assessment of the impact of COVID-19 on ethnic minorities. If we want to resolve the disparities identified in the PHE report, it is critical that we accurately understand the causes based on empirical analysis of the facts and not preconceived positions. Mr. Speaker, on Tuesday, my right honourable friend, the Secretary of State for Health, confirmed to the House that Public Health England has now completed its review into disparities into the risks and outcomes of COVID-19. The review confirms that COVID-19 has replicated and, in some cases, increased existing health inequalities related to risk factors, including age, gender, ethnicity, and geography, with higher diagnosis rates in deprived, densely populated urban areas. The review also confirmed that being black or from a minority ethnic background is a risk factor. This racial disparity has been shown to hold even after accounting for the effect of age, deprivation, region, and sex. Mr. Speaker, I want to thank Public Health England for undertaking this important work so quickly. I know their findings will be a cause for concern across the House, as they are for individuals and families across the country. The government also shares this concern. It is why it is now reviewing the impact and effectiveness of its actions to lessen disparities in infection and death rates of COVID-19 and to determine what further measures are necessary. It is also clear that more needs to be done to understand the key drivers of these disparities and the relationships between different risk factors. The government will commission further data research and analytical work by the Equality Hub to clarify the reasons for the gaps in evidence highlighted by the report. But taking action without taking the necessary time and effort to understand the root causes of these disparities only risks worsening the situation. That's why I'm taking this work forward with the Race Disparity Unit in the Cabinet Office and the Department for Health and Social Care, and I will keep the House updated.
Jill Furness.
Thank you, Mr. Speaker, for granting this urgent question today. On the 2nd of June, Public Health England published its long-awaited review into disparities in the risks and outcomes of COVID-19 on BAME communities. The review confirms what we already know, that racial and health inequalities amplify the risk of COVID-19. The review found that those from BAME backgrounds were more than twice as likely to die from COVID-19 than white people, and that BAME healthcare workers are at particular risk of infection. These lives matter. And it is time for the government to take action on the devastating impact that this virus has had on BAME communities. But Public Health England's review fails to make a single recommendation on how to reduce these inequalities, protect workers on the front line, or to save lives. This is despite the fact that its terms of reference set out to suggest recommendations for further action. Will the Minister urgently explain why this review has failed to do so? The Government has now said that the Race Disparity Unit will publish recommendations on the findings from the review. When will these recommendations be published alongside a plan for their implementation? Over 1,000 individuals and organisations supplied evidence to the review. Many suggested that discrimination and racism increase the risk of COVID-19 for BAME communities. Will the Minister explain why these views were not included in the review, and does she accept that structural racism has impacted the outcomes of COVID-19? Does the Minister agree that it is now time to address underlying socio-economic inequalities facing BAME communities, and will she confirm the government will take action to do so? BAME workers on the front line of this crisis are now anxious for their lives. Will the Minister listen to Labour's demands to call on all employers to risk assess their BAME workforce? Coronavirus thrives on inequality, and there is no more important time to tackle racial injustices in our society to save lives during this crisis. It is now up to the government to take action and show its commitment that black lives matter.
Minister.
Thank you, Mr. Speaker. It's absolutely imperative that we understand the key drivers of these disparities, the relationships between the different risk factors and what we can do to close the gap. That way, we will ensure that we are not taking action which is not warranted by the evidence. The Honourable Lady is right. The PHE did not make recommendations, and that's because they were not able to do so. Some of the data needed is not routinely collected, and acquiring this data will be extremely beneficial. And as I said in my response, that's why I'm going to be taking work forward to fill the gaps in our understanding and review existing policies, develop new ones where needed off the back of this. But it is important, Mr. Speaker, to remind ourselves that this is a review conducted in a short period of time which sets out firm conclusions. As the author of the report said on Tuesday night, there is a great deal of background and detailed information we think will be helpful. It is not easy to go directly from analysis to making recommendations, and we need to get the report widely disseminated and discussed before deciding what needs to be done.
Caroline Noakes, to the committee.
Thank you, Mr. Speaker. The Race Disparity Unit is, of course, now in the Cabinet Office at the heart of government. And my honourable friend is right when she says that they need to have all of the data that is available to make the correct recommendations. But will she reassure me that from the heart of government, this will not just be a matter for the Government Equalities Office or for the Department for Health and Social Care, but it will include the Department of Work and Pensions, the Department for Transport, the Department for Education, all those areas where we might expect to see real commitment to action that will make lives better for our BAME communities?
My right honourable friend is absolutely right, and I thank her for that question. Equalities is not something that happens in the Government Equalities Office. Equalities is something that happens across Whitehall, and every department does have responsibilities to ensure that it is making the policies right for all the people who are impacted by the activities that are carried out there, and that's something that I will continue to work with them on.
Joanna Church.
Mr. Speaker, I want to reassure Scotland's BAME communities that this is an issue that the SNP are taking very seriously. On the 20th of May, the Scottish Government published Public Health Scotland preliminary analysis, which suggested that the proportion of BAME patients amongst those seriously ill with COVID is no higher than the proportion in the Scottish population generally. However, the Scottish Government are treating these findings with caution, given the findings in England and Wales, and further work is underway to deepen understanding of the risk factors and to improve analysis. It was good to hear the Prime Minister agree with my right honourable friend, the member for Ross Skye and Loch Arbour yesterday, that Black Lives Matter. However, actions speak louder than words. There are some government policies that impact more strongly on BAME communities. What action will the UK Government take to review its no-recourse to public funds policies, since the Prime Minister revealed that he was unaware that thousands of people are locked out of available support due to these rules? And also, why won't the UK Government lower the earnings threshold for statutory sick pay, which is forcing people in BAME communities out to work when it's not safe for them to be working?
Thank you, Mr. Speaker. On the issue of Public Health Scotland having different results from Public Health England, this is something that we are finding in terms of a range of reports, and it's one of the reasons why we're not rushing to recommendations. It's important to note that the Public Health England review did not take into account other factors. On the issue, other factors such as comorbidities, for example. On the issues of no recourse to public funds, we have taken extensive action to support those with no recourse to public funds. These range from protections for renters, for evictions, mortgage holidays for those who need it, as well as support for those who are vulnerable and need assistance with access to medication and shopping. They also include the Coronavirus Job Retention Scheme and the Self-Employed Income Support Scheme. Those with no recourse to public funds do have access to statutory sick pay, as she mentioned. Furthermore, if an individual has been working in the UK and sufficient national insurance contributions have been made, they may be entitled to claim contributory employment and support allowances. We have allocated £750 million funding for charities as well, who are providing vital support to vulnerable people at this difficult time. Thank you.
Richard Fuller.
Thank you, Mr. Speaker. The sensitivity to disproportionate risk is greater when the leadership of institutions includes representation of those most at risk. This is an issue for corporations such as GTR and London Transport, particularly GTR with the issue of Ms. Mujinga. It is an issue for NHS where there has been, although a historical overrepresentation of BME employees in the NHS and underrepresentation in the leadership of the NHS. And in this instance, it's a case for the leadership of PHE, where I believe that not one of either the CEO or his direct reports is drawn from the BAME communities. Will my right honourable friend look into the issues of how the government can promote diversity in the leadership of our leading institutions?
I thank my right honourable, my honourable friend for that question. It is an important point to make. We do want to see diversity in leadership across institutions in this country, and one of the reasons why we asked Professor Kevin Fenton, who is a black surgeon, to actually lead on this review. It's something that's an issue that's very close to my heart. As a woman, a black woman who's also Equalities Minister, this is something that I'm going to be looking into as well, and I can definitely take this forward and examine what's happening across our institutions. But I think
Rachel Maskell.
Thank you, Mr. Speaker. In 2010, Professor Marmot published his report into how structural inequalities predisposes the poorest to the worst health outcomes. We know how race inequality is entwined with this. A decade on, the inequalities have grown. The Public Health England report has now highlighted the fatal consequences of this. Even today, low-paid workers are exposed to the greatest infection risks, and lockdown easement is reinforcing this. Will she pause the easement plan until there is a full mitigation plan in place to address these inequalities?
Mr. Speaker, I think it's important to reiterate that any easement plan is being made in conjunction with scientists. The government has reviewed and explained guidance extensively across all sorts of occupational areas. It is important that employers make risk assessments for their staff so that they are not unduly exposed to the virus. Thank you.
Michael Longley.
Thank you, Mr. Speaker. As a former employer, and actually as a new employer in this place, I am acutely aware of the impact I can have on the welfare of my employees. So can my honourable friend perhaps say how important it is to engage with employers in the work that she does?
That's a very good point. I do think, and I thank my honourable friend for that question, engaging employers as well as employees will be absolutely essential. Professor Kevin Fenton of PHE has already undertaken extensive stakeholder engagement on this issue, and I intend to assist him in continuing that excellent work. I also intend to ensure that this approach continues to cover other factors such as age, sex, geography and deprivation as well.
Clara Anderson.
Mr. Speaker, the Spanish flu epidemic led to huge, wide-scale social reform, and this report points to the need to do the same. Almost 3/4 of health and social care staff who have died as a result of COVID-19 are from black and ethnic minorities. Why does the review fail to mention the occupational discrimination faced by BME healthcare staff, which has been highlighted by the British Medical Association and the Royal College of Nurses and needs urgent attention?
Minister.
Mr. Speaker, I think it's again important to remember what the purpose of this review was, which was to look at specific factors. There are other factors which we are going to continue looking at. This is not the end of the process. This is the beginning of the process. I'm going to take the information from this first stage, and this is going to be part of the work that we will carry out in the programme going forward. But it must be said, Mr. Speaker, that we are working around the clock to protect everyone on the front line during this pandemic for as long as it is required, and that will include BAME members on the front line.
Withdrawn. Helen Hayes.
Thank you, Mr. Speaker. Belly Majinga died tragically from coronavirus after being spat at whilst at work at Victoria Station. She was at increased risk as a result of her ethnicity and underlying health conditions. Thousands of BAME frontline workers recognise the risks that Belly faced as the same risks that they continue to be exposed to. And her appalling death must lead to change. There must be justice for Belly Majinga and her family by way of meaningful action to stop unnecessary BAME frontline deaths now. When will the government instruct employers to put in place the comprehensive protections which are needed for all BAME staff and other vulnerable workers who need protection to stop them dying now?
I thank the Honourable Lady for raising the case of Belly Majinga. I've been extremely saddened and shocked by what I've read about her death. I understand, though, contrary to what she says, that the reason the British Transport Police are not taking further action in Belly Mujinga's case is because senior detectives are confident that the incident at Victoria Station did not lead to her contracting COVID. Nevertheless, this was an appalling incident, and frontline workers like Ms. Mujinga deserve to be treated with respect at work, especially during this challenging time. We know there are a high number of BME individuals working in health care, social care and transport, and it is vital we understand more about their experiences during this next piece of work I'm taking forward. But it is important to reiterate that the government has already done what she has said, which is ensure that ensure that employers know that they must risk assess their employees before they put them out to work. And that is the message that we will continue to reiterate.
Lynn Sachs.
Thank you, Mr. Speaker. The report identified age as the greatest disparity. So can the Minister assure me that she is conscious of the sacrifices older people are making and that she will do what she can to ensure older people are treated equally as far as possible?
Yes, I do agree with that. The largest disparity found was by age. Among people diagnosed who are 80 or older, they were 70 times more likely to die than those under 40. And she is absolutely right. That is something that I will be doing. Thank you.
Mr. Speaker, I said to the Secretary of State for Health earlier on in this week that it's one thing to say that Black Lives Matter and quite another to force black people and people from BME backgrounds out to work because they have no choice other than to go to work because they have no recourse to public funds. No recourse to public funds is a racist policy. Will she abolish it now?
I think I must just push back on some of what the Honourable Lady has said. It is wrong to conflate all black people with recent immigrants and assume, which is what she has just said, that we all have to pay a surcharge. That is wrong. I am a black woman who is out to work. My employers, and this House has done everything it can to make sure that I am following the guidelines and making sure that all of us are. So it is absolutely wrong to try and conflate lots of different issues and merge them into one just so that it can get traction in the press. And I go back to what I said in my original, my original statement. It is not right for us to use confected outrage. We need courage to say the right things, and we need to be courageous, Mr. Speaker, in order to calm down racial tensions and not inflame them just so that we can have something to put on social media.
Mr. Speaker, every death in this pandemic is a tragedy, and we have to know how to protect the most vulnerable better. Yet this Public Health England analysis is based on incomplete data for ethnic minority groups because it doesn't include two key factors: occupation or comorbidities in the deaths amongst ethnic minority groups. Why not? Particularly given the undertakings given by ONS to the Women and Equalities Select Committee 2 years ago when we did a report into the race disparity audit, when it was acknowledged that there was huge discrepancies and inconsistencies in the way that data was collected for ethnic minority groups. Can she address this?
Minister. I thank the Right Honourable Lady for that question. She is absolutely right. There was more that I would have been hoping to see, but I do understand that PHE did not have all the data that it needed. Some of the things that weren't present included comorbidities, population density, public transport use, household composition, housing conditions. That is why it is important that I take this forward, and that is all the things she has listed are the things that we will definitely be looking at in the next stages.
Thank you, Mr. Speaker. Anyone in Westminster yesterday couldn't have failed to have noticed the Black Lives Matter protest inspired by Minneapolis, and the placard that sticks in my mind most is one that said, "Being black should not be a death sentence." She talked about having courage and being a black woman herself. She and I are both BME parents. Can we really look into our sons' eyes and say that we acknowledged it? Surely we need action. It's not good enough. So when will we see a detailed plan with deliverables, with objectives, with dates, with buy-in from all our diverse communities, so that this doesn't just look like a box-ticking exercise?
Minister.
Yes, I agree with her. I do agree with her that we cannot be seen to do anything that looks like a box-ticking exercise. But we also should not just be accepting statements like being black is a death sentence in this country. It is not true. It is true that there are disparities. It is true that there are other factors that can make outcomes worse. Let's look at that. But let us not in this House use statements like being black is a death sentence, which young people out there here don't understand the context, and then continue to believe that they live in a society that is against them, when actually this is one of the best countries in the world to be a black person.
Rob Butler.
The report into disparities in risks of contracting COVID-19 is of course extremely concerning. So how will the Minister ensure that everybody is treated equally, regardless of ethnicity?
I thank my honourable friend for that question. We are actively considering the experience and circumstances of people right across society so that while the UK will be changed by this experience, we can ensure that we emerge stronger and more united. All parts of the government must take care to pay due regard to the equality impacts of policy decisions in line with the public sector equality duty and our commitment to promoting equality.
15 withdrawn. Jason McCartney.
Thank you, Mr. Speaker. I join the Minister in the utter condemnation of the horrific murder of George Floyd. Black lives do matter. Will the Minister agree with me that the UK should be very proud indeed of the huge contribution the BAME workers have made during this crisis, both as key workers and in the health service? And with that in mind, following this review, will she say once again what immediate action she is taking to address these disparities issues?
I thank my honourable friend for that question. He's absolutely right. In a time of crisis and great worry for so many of us, it's been heartening to see different communities across work together hand in hand, and also for people to acknowledge the huge contributions people from BME backgrounds have made to this country. And what I will say, again, as I said before, that we must make sure that we carry out the right actions. We mustn't rush to do things that people are asking for if it turns out that they're going to be the wrong steps to take, but look right. It is not about optics, it is about doing the right thing. And that is why we are not rushing. We're going to have a proper programme. We're going to look into this. We're going to look at all of the studies that have come out, not just the PHE one, and make sure that we have an appropriate set of recommendations which will have confidence in various communities.
John Butler.
Thank you, Mr. Speaker. Mr. Speaker, the PHE report has no third-party submissions. Where are the missing submissions, and will the Minister place them in the library? Mr. Speaker, this government has a reputation of whitewashing reports and hiding from the consequences of structural racism. The Minister says she's not going to rush. In 2016, the Conservative Prime Minister said she would tackle the burning injustices in society. What happened? Where's the Social Injustice Office that was promised in 2016? There's not rushing, but there's really taking your time and avoiding the issue. The Windrush report was delayed, edited, and some parts were deleted. This is a worrying trend of this government. The PH report essentially said that there is nothing internal why black, Asian and minority ethnic people are dying at twice the rate of COVID deaths than white counterparts. There's nothing internal. That means it is external. And it's external and it is accelerated by this government.
I utterly reject what the Honourable Lady has said. And I think I need to clarify some confusion that seems to have arisen on this, Mr. Speaker, with permission. The government commissioned a review to analyse how different factors can impact on people's health outcomes from COVID-19. That's what was published this week. Separately, PHE has been engaging with a significant number of individuals and organisations within the BME community over the past couple of months to hear their views. That was not part of this. And a lot of people think that that's something that should have been in this report. We'll be building on and expanding on this engagement as we take this work forward. But that is different from the report which we have commissioned. Thank you.
To Flick Drummond.
Thank you, Mr. Speaker. I've read the report and I do understand that it's been rushed, but it does raise a number of issues, such as the effect of age, ethnicity, but also needs further examination of other issues such as comorbidities, the socio-economic issues, and also multi-generational living, which is a case in Italy as well. Does the Minister feel that this report has gone far enough?
The short answer, Mr. Speaker, is no. The report is welcome, first steps, but it certainly hasn't gone far enough, and we will take it where we think it needs to get to.
Doris Sultan.
Thank you, Mr. Speaker.
Speaker, the coronavirus doesn't discriminate, but the system in which it is spreading does. Higher rates of poverty, overcrowded housing, precarious work, and jobs on the front line mean that if you're black or Asian, you're more likely to catch the virus and to be hit worse if you do. Mr. Speaker, Black Lives Matter is not a slogan, and we are owed more than confirmation that our communities are suffering. We're owed justice. So will the Minister commit to a race equality strategy covering all Whitehall departments so we can rebuild back by tackling the underlying inequalities and systemic injustice that coronavirus has so brutally laid bare?
Minister.
Thank you, Mr. Speaker. I think all I can say to the Honourable Lady is that this government is doing every single thing that it can to make sure that we eliminate disparities that we are seeing because of this disease. But we must remember that as we talk about different groups, that there are many other groups that have been impacted based on age, even based on gender. We're looking at all of these, and I'm not going to take any lessons from the Honourable Lady on race and what I should be doing on that. I think that this government has a record to be proud of, and we will wait and see the outcomes of the following steps and the recommendations. Thank you.
Sarah Britley.
Thank you, Mr. Speaker. Can the Minister tell me what assurances she can give my constituents in Hyndburn and Haslingden that the government is recording COVID-related deaths based on ethnic data, and what steps she's taken in supporting the NHS in ensuring that BAME communities have the same positive health outcomes as all other communities?
Thank you, Mr. Speaker. I think this goes back to the point I made about making sure that everyone is treated equally. We do need to look at some of the data that is being collected to make sure that there is consistency across the board. That's something that's come out from the different reviews that have been done on this issue, and we'll continue to work on that. Thank you.
Christine Jardine.
Thank you very much, Mr. Speaker. The review, as we know, found that people of Chinese, Indian, Pakistani, other Asian, Caribbean and other black ethnicity had between 10 and 50% higher risk of death when compared to white British. Yet only 11 of the 89 pages explore the issue of racial inequalities in coronavirus deaths. Now, we've also heard that there are reports that there is a chapter referring to individuals and stakeholder groups which is not included. Can the Minister assure us that there is no reason why the people she's referred to as being dealt with separately should not have been included in this report? And can she assure us that what we will see from this government is the full, unredacted, all the evidence from individuals and stakeholder groups and address the imbalance in the evidence in this review?
Thank you, Mr. Speaker. Again, I will repeat this point, that it's important that we understand the key drivers of the disparities. What we commissioned was a quantitative review. We want to be evidence-led. Stakeholder engagement is important, but we do not want to conflate the two things, and that is something that we'll be taking forward in the future.
Dr. Liam Fox.
Thank you, Mr. Speaker. One of the biggest disparities in deaths in COVID is actually the gender difference. The standardised mortality rate amongst men is 781 per 100,000. Amongst women, it's 439 per 100,000. Across all communities, we're talking about fathers, brothers, sons, husbands, partners, friends. This affects the whole country. Can I ask my honourable friend to ensure that the resources are given to understanding why this gender difference is there and how we can tackle it in the future? Because I'm sure that one thing that the whole House can agree on is that all lives matter and they all matter equally.
That's absolutely correct. I do agree with the right honourable gentleman, and at a risk of sounding cliched, this is a government that we want to work for everyone. But it is not yet fully clear what drives the differences in outcomes between males and females, Mr. Speaker. Some could be driven by risks of acquiring infection due to behavioural and occupational factors, again, something that the PHE review was not able to look at, and by differences in how women and men develop symptoms and biological and immune differences. But this is something, he's absolutely right, this is something that does need to be looked into further, and we are actively working on that.
Diolch, Mr. Speaker. 20% of all reported cases of COVID-19 in prisons across England and Wales have been recorded in Welsh prisons, despite the fact that Welsh prisons hold just 6% of the total prison population. Now, we know that a disproportionate number of those within the Welsh prison system are from black, Asian and minority ethnic communities. And so what plans does the government have to work with the Welsh Government to address this racial disparity and the health implications arising from it for BME communities?
I thank the honourable gentleman for his question. As he will know, the review was for Public Health England. I haven't seen the figures, the Welsh figures that he's talking about, but if he writes to me separately, I think I might be able to provide some more information after speaking to officials.
Mr. Buchan.
Thank you, Mr. Speaker. We talk a lot about levelling up, but normally in the context of the North versus the South. But as my honourable friend knows, in our cities, in particular in London, we have huge inequalities. Will my honourable friend assure me that we will look out for all of those left behind?
Yes, thank you, Mr. Speaker. She is right. Levelling up is not just about North and South. It's going to cut across lots of different areas. And responding to the challenges of COVID-19 specifically does not mean the government has forgotten that. We remain committed to a levelling up of every region and nation, and even within regions and nations of the UK. And this can still be a critical part of how we actually get back to normal. Thank you.
Kemi Badenoch.
Thank you, Mr. Speaker. Earlier, the Minister said equalities is something that happens across Whitehall. Self-employed women, including BAME women who have had maternity leave in the last 3 years, lose out under the Treasury, under the Chancellor's COVID-19 self-employed income support scheme. This is overt pregnancy discrimination, pure and simple, by her government. What's she doing to rectify it?
Mr. Speaker, the government has introduced an unprecedented scheme of packages to help all those people financially impacted by COVID-19. But as he knows, we are using earnings data, average earnings data, based over the last 3 years. It does mean that some groups are impacted, but because of the way HMRC collects information, this isn't necessarily something that we can address, and that's why we have other schemes in place which people hopefully should be able to access.
Richards.
Thank you, Mr. Speaker. The recent report doesn't include recommendations going forward for people with underlying health conditions or by employment type. Will the Minister commit to looking into these factors further so we can properly address the causes of disproportionate effects of COVID-19 on BAME communities?
Yes, it's a short answer. We can look at that. Thank you.
27 withdrawn. Scott Benton.
Thank you, Mr. Speaker. Blackpool contains some of the most deprived neighbourhoods in the whole of England, and in some of those communities the life expectancy for the poorest is 20 years below the national average. The PHE report makes it explicitly clear that deprived communities such as those in my constituency have been disproportionately affected by COVID-19, a fact which is supported by our high local infection rate. Does my honourable friend agree with me that it is absolutely imperative that this government redoubles our efforts to reduce health inequalities between the richest and the poorest?
Yes, absolutely. We will look very closely at the health inequalities aspects of this report, and that's part of the work that I'm going to be carrying forward. Thank you.
Chris Bryan.
I commend the member for Blackpool South on what he's just said, because it's what I was about to say. But I'm not going to sit down yet, if that's all right. Because it's a simple fact. In my constituency, the Rhondda has one of the highest death rates per 100,000 head of population in the country, and therefore in the world. And I know that being poor is certainly an early death sentence by some 20 years compared to richer parts of the country. And that's because people who are subsisting on poor wages, on few hours, on unsafe labour, in difficult working conditions, without proper protection, with miserly benefits, with statutory sick pay which doesn't enable people to put food on the table, and relying on food banks, those are the people who are dying. And I just say, surely there's one lesson we must learn out of coronavirus, which is that we must pay our key workers properly so that they can put food on the table and not rely on food banks.
I don't think there's anyone in the House who can disagree with what the honourable gentleman has just said. I do agree with him. I think that we are putting forward policies to address some of these things, but we do know that there are some things we're looking at in the short term, specifically related to coronavirus, and medium to long term interventions. I think he and I can have conversations about that in the future.
Thank you, Mr. Speaker. The lack of leadership and transparency in Public Health England and NHS England has been shamefully exposed with BAME health workers dying at a greater rate. COVID just showed us what it means when these institutions aren't equal, with BAME workers saying they did not have the same access to PPE to their white colleagues, and they felt pressured to work on the front line. As both Public Health England and NHS England are independent, how will my honourable friend hold them to account?
She is absolutely right to raise the concerns that we have been hearing anecdotally. This is something I think needs to be handled sensitively, because on the one hand, we do know that there are areas that need to be addressed, but on the other hand, I don't want anyone to think that we are criticising the NHS workers for not looking after their own. It's something that needs to be handled absolutely sensitively, but we are on top of this, and I thank her for raising this point.
Stephen Timms.
Thank you, Mr. Speaker. Does the Minister agree with the report that there are additional barriers which make it harder for BAME communities to access key services? Will she in particular press her colleagues to suspend the no recourse to public funds restriction, which has prevented thousands of hard-working BAME families, many with children born in the UK, from claiming universal credit during this crisis?
I refer the honourable gentleman to the answer that I gave earlier. I know that this is something that a lot of people are concerned about, and we have taken extensive action to support those with no recourse to public funds. We understand there may be difficulties for perhaps failed asylum seekers who cannot return home, and we are continuing to provide free accommodation to those who would otherwise be destitute, and that's just another example of how the government is looking at these things intensely. We have not forgotten anyone. Thank you.
Thank you, Mr. Speaker. The Cabinet officers raised disparity departments in driving change where disparities are found. Will the Minister ensure that the unit is dedicated to understanding how to close the gap around coronavirus?
Yes, I think that is. I think he's absolutely right. There are a whole range of areas that we need to look at, and I'll just go back to what I said earlier about this being just not the end of the review process, but actually rather the beginning. And I would urge honourable members from across the House that if there are areas that they want us to look at, to please write to me so that we can make sure we include them.
Ready?
Thank you, Mr. Speaker. Does she not understand that no recourse to public funds reinforces the very structural inequalities that the Black Lives Matter campaign is trying to call out? It's not leaving my constituents looking for mortgage holidays, it's leaving them destitute. And that's not just unequal, it's inhumane. So will the government please review this situation and allow people to get the support that they so desperately need?
I will again repeat the point I made earlier, not to conflate black people with people who are not having any recourse to public funds. It is a very, I'm not going to say the word disingenuous argument, Mr. Speaker, but I do think that this is something that we need to be very clear about and not muddy the water in terms of what's going on.
Not Fletcher.
Thank you, Mr. Speaker. I've received many letters from the constituents across the Bolsover constituency saying how proud they are of how many BAME people have contributed to our health service and to our care system. Does the Minister agree that they have made a fantastic contribution and we should welcome that?
Absolutely, absolutely. We do welcome it, and it is very heartening, as I said earlier, to see that there are communities all across this country that are not just saying but showing how much we value the contribution that black and minority ethnic workers, key workers in particular in our system, provide to this society.
35 not here. Jen Stevenson.
Thank you, Mr. Speaker. I'm a very proud Wolverinian, and I'm proud that many of my fellow Wolverinians have roots all over the world. Does the Minister agree that those people are now concerned about this report? We need to keep pushing hand washing, social distancing, and does the Minister also agree that it's up to members in this place to set an example to our BME communities?
I think she is absolutely right and raises a very important point, Mr. Speaker. People do look to this House to set an example across the country, and those of us in this House must demonstrate that we not just agree with the guidance but also show that we're following the rules as well.
Mr. Speaker, the research shows amongst many disturbing findings about race disparities that diagnosis rates are higher in deprived and densely populated urban areas, and that our great cities like Liverpool have been hardest hit by the virus. Does the Minister accept that the reason to research COVID disparities is so that effective action can be taken to address them. So will she undertake to ensure right now that the government allocates resources to combat COVID in such a way as to address these inequalities? She can do that now, rather than on a crude per capita basis that completely ignores the realities of who's hardest hit and why.
We are distributing funds in many different ways. I've spoken to, for example, the mayors of combined authorities, and they've raised this issue with me as a Treasury Minister, and we will continue to look at it. Thank you.
Thank you, Mr. Speaker. The report does reveal correlations between the virus and certain other conditions. Diabetes is mentioned on around 20% of death certificates, but this rises to almost half of the certificates for Black and Asian deaths. Does the Minister agree that these links with other health conditions, comorbidities, need to be studied thoroughly?
Yes, the honourable member is right, and I think that within some medical circles there is an expectation that when you do account for comorbidities, I believe there was an article in the Times which referenced the SAGE report, and when you do account for them, that some of these differences do reduce to zero. And that is why we're not rushing to take into account what one specific report's saying. We're looking at what all the different reports have said, like the one from Public Health Scotland, for instance, to make sure that we find out exactly what is going on.
Mr. Speaker, I've received a great deal of correspondence from constituents who are rightly angry at the government's delay in publishing this report. And given the lack of recommendations, guidelines or action plan, will the Minister also now commit to establishing a post-COVID-19 equality strategy to take forward work to develop policies to tackle health inequalities post-COVID-19?
The Honourable Lady I think the Honourable Lady is asking for what we're doing at the moment. This is what we're planning to do. That's what we're going to be looking into. And about accusations that the government delayed this report, it's simply not true. We asked for a report for the end of May, and that report was brought to this House at the first available opportunity, Mr. Speaker, which I'm sure you will appreciate.
Alexander Stafford.
Thank you, Mr. Speaker. Health inequalities are also related to historical work conditions and adjustable diseases, such as the high rates of ileosis and chronic bronchitis, as seen amongst some of my Rother Valley residents, many of whom were former miners. Does the Minister agree with me that these inequalities ought to be looked at as well in the context of the COVID-19 outbreak?
Yes, I think that, as I said before, there are a range of things that we will need to consider. We want to be evidence-led, and I will be raising this with the various bodies, not just Public Health England, to make sure that we are being led by the science more than anything else.
Manjeet Singh Desai.
Thank you very much. Mr. Speaker, almost 3/4 of health and social care staff who were battling this virus on our behalf, but who subsequently died as a result of COVID-19 are Black, Asian and minority ethnic. So I'm hoping, against hope, that one of the few positives to take from this national crisis is that those espousing hatred against minorities and migrants will now be ignored, and this will lead to less racism and greater community cohesion. But can the Minister explain why the Public Health England review failed to mention the occupational discrimination faced by BAME healthcare staff, which has been identified by both the British Medical Association and the Royal College of Nursing?
Yes, he's right. It goes back to what I said earlier, that Public Health England didn't necessarily have the data, because data is being looked at from different quarters and different institutions have different data. That was something that I really wanted to see, because I think it will go some way to explain the gaps, and I'm going to be taking that forward and seeing if we can get this information out. Thank you.
We now come to Mark Harper.
Mr. Speaker, thank you. Can I draw to my honourable friend's attention the information published this week by the CQC on the 2nd of June, which highlighted the much higher death rate amongst people with learning disabilities, both from COVID and non-COVID courses, a 134% increase over the last year, and ask her to talk to her health department colleagues about what that implies for access to testing for people working age people in the care sector.
Minister.
I thank him for that question. He raises an interesting point. We are aware that some of the risk factors associated with poorer outcomes do include are more prevalent in certain groups of the population, and that does include people with learning disabilities. So he is right to raise that, and I will speak to my colleagues in the Health Department on that issue again.
Andrew Griffith.
Mr. Speaker, all lives matter. They matter now, and they mattered in March and April, when many of my colleagues couldn't get a test when they needed one. Would the Minister talk to her colleagues about changing the attitude of Public Health England towards working with the private sector to mobilise testing capacity?
Minister.
The Honourable Gentleman is absolutely right. We do need all hands on deck on this issue, and we definitely don't want silo working where people believe that only the public sector is going to be able to help sort this issue. We want them to be working hand in hand with the private sector. We've seen other key workers, supermarkets, HGV drivers, etc. The private sector has actually done a fantastic job in helping us weather this crisis, and I would like to see more of that happening within the health space.
45 not here. Joe Gideon.
Thank you, Mr. Speaker. The report identifies death rates in the most deprived areas are more than double those in the least deprived. Will the Minister agree with me that growing capacity in community development is essential in ensuring equality of opportunity and levelling up in cities like Stoke-on-Trent?
Yes, I do agree with her. I don't think there's anything further to add. Levelling up is a priority for the government. I will never get tired of saying that. And it's not something that I look at just in my equalities role, but also in my Treasury role. And I look forward to working with her on those issues.
Murray Kelly-Ford.
Mr. Speaker, in February of this year, Professor Mohammed published his review of health inequalities a decade after his original report. He made several recommendations, the first being the creation of a cross-government, cross-party strategy led by the Prime Minister to address these health inequalities. Given the fact that COVID-19 has shown how far we are from achieving a fair and equal country, can the Minister say whether the government will incorporate this recommendation as a key part of the recovery from coronavirus?
I'm afraid I haven't seen this specific report. I'm not sure I've seen this report that she's referring to, but if she writes to me, I can give her a much more comprehensive response than at the dispatch box. Without seeing the recommendations she's referring to, I'm not sure that I can fully comment, but I will look forward to seeing that letter, and hopefully it'll have things that we can include in there.
That completes the UQ. We're now going to have a 3-minute suspension. 3-minute suspension. Order. Order. We now come to the next UQ, the Secretary of State for Northern Ireland. I will call Sir Geoffrey Donaldson.
To ask the Secretary of State for Northern Ireland if he will make a statement on the abortion regulations for Northern Ireland.
Secretary of State.
Thank you, Mr. Speaker. As Minister responsible for this policy area, I shall answer this question. The Government originally laid the Abortion Northern Ireland Regulations 2020 in Parliament on 25th of March on the provision of abortion services in Northern Ireland. The regulations came into force on the 31st of March 2020 and became law on access to abortion services in Northern Ireland. The regulations were originally required to be debated by the 17th of May to remain in force as law. However, the unprecedented situation created by COVID-19 has impacted on parliamentary processes, and virtual voting systems were not yet fully implemented in time for these regulations to be debated in both houses. Therefore, the Abortion Northern Ireland No. 2 Regulations 2020 were laid and came into force on the 14th of May, revoking the earlier regulations. This gives Parliament an extra 28 days to consider and scrutinise the regulations properly, given the nature of this policy. This approach has ensured that the law on abortion in Northern Ireland, itself a requirement specified by this House in the EF Act, continues to apply with no risk or gap or legal uncertainty, and services can continue on the same basis in Northern Ireland as